Imagine if shining a light could make our brains and bodies work better. Sounds like science fiction, right? Well, it's closer to reality than you might think. Scientists are exploring a special kind of light called red light therapy. Red light therapy, also known as low-level laser therapy or photobiomodulation, has garnered interest for its potential therapeutic benefits, especially since the pandemic. The COVID-19 pandemic in the early 2020s accelerated interest in non-invasive health treatments, including RLT, as people sought ways to boost immunity and manage health conditions at home. Several studies and research have reported positive results for various health issues for the 50-plus community. Imagine you have a magic flashlight that can heal your body. In this special treatment, a light source is placed close to or on your skin. This light is made up of tiny particles called photons, which are like little energy sparks. When these photons enter your skin, they find special parts inside your cells called chromophores. It's like the photons are little keys, and the chromophores are the locks. When the photons unlock the chromophores, they start a chain reaction, like a line of dominoes falling. This reaction helps your body in many ways. It speeds up healing, helps new tissue grow, boosts blood flow, reduces swelling and pain, and makes your cells work better. Imagine you have a cut on your arm. When you shine the magic flashlight on it, the light goes into your skin, finds the special cells, and tells them to start fixing things faster. Not only does it help when you're hurt, but new research shows that the light can also make healthy tissues and cells work even better, like giving them an extra boost. This study found that near-infrared light can pass through the skull and help the brain grow new cells and connections, while also reducing inflammation. This leads to better thinking and memory in patients. For people over 50, dementia can be a scary and challenging condition. The idea that something as simple as light could help is exciting and hopeful. It offers a new way to improve brain health and quality of life. People who received RLT showed better memory and learning abilities. They could remember names, faces, and events more easily. In the study titled Efficacy of Low-Level Laser Therapy in the Management of Knee Osteoarthritis, a meta-analysis of randomized controlled trials, researchers found that low-level laser therapy significantly reduced pain and improved function in patients with knee osteoarthritis. This provides a viable pain management and anti-inflammatory treatment option for older adults suffering from osteoarthritis. Turning our focus to skin health, the effects of low-level laser therapy, LLLT, on facial skin rejuvenation study revealed that RLT was effective in improving skin tone, texture, and elasticity, while also reducing the appearance of wrinkles and fine lines. This offers a non-invasive anti-aging treatment option for older adults seeking cosmetic improvements. Overall, while red light therapy has been known and studied within scientific and medical circles for several decades, its education and adoption by the general public have significantly increased in recent years. This growth has been driven by advancements in technology, increased availability of home-use devices, and widespread promotion through media and influential figures. These studies, along with many more, indicate that red light therapy holds promise for addressing various health issues in individuals aged 50 and above. However, it's essential to consult healthcare professionals before starting any new treatment regimen to ensure it's appropriate for your health needs and conditions.